So the first question that we're going to want of these 10 is which nutritional supplements, herbs, vitamins, minerals do you recommend? Which nutritional supplements, herbs, vitamins, minerals do you recommend? Number 2, what is your opinion about whole plant-based fats? That means avocados, olives, raw seeds, and raw nuts. That's what it means. Number 3, what is your thought about alcohol? Number 4, do you recommend bariatric surgery? Number 5, do you recommend a high sprout diet that Hippocrates recommends? Should that be our goal? To every lunch and dinner being trying to have as much sprouted onion, clover, broccoli sprouts. Is that the ultimate goal? Number 6, should we be doing green vegetable juices and sprout juices? Is that the goal? Number 7, salt. Forget about bad salt, but what about like salts that they claim are healthier salts? Some people are saying that we need salt in our diet. Number 8, the new vegan burgers, the new popular brands of vegan burgers made from pea protein. Is this something you recommended? Number 9, phytochemicals. Joel Fuhrman said phytochemicals are nature's magic pills. What are phytochemicals? And number 10, Dr. Fuhrman has a phrase called G-bombs, greens, beans, onions, mushrooms, berries, seeds. What about whole grains? Why is whole grains, meaning quinoa, millet, amaranth, teff, buckwheat, wild rice, why are they not in the G-bombs? Aren't they a core part of our entire program? So if you would give us feedback on this, whatever you want to share with us in any order, just speak out when you're ready and comment on any of these so we can go through these 10 points.
Why don't we move around, but let me just address the G-bombs thing first, to put that aside, because that's something that an acronym I recommend. I'm not saying G-bombs are all people should eat. I've never said G-bombs is the diet I want people to follow. G-bombs is an acronym that identifies GBOMBS, 6 foods that have been shown to have powerful anti-cancer and longevity-promoting benefits. There are other foods like tomatoes and things that aren't in the G-bombs that have plenty of anti-cancer and benefits. It's not all the foods in the world that are good for you. It's just 6 top foods that I want people to try to include in their diet regularly, almost every day. It's not the entire dietary spectrum or dietary portfolio. There's plenty of additional healthy foods you can add to that. I'm just saying eat your G-bombs, eat other things too, but eat your G-bombs because those foods particularly have a lot of scientific evidence to slow the aging process, to prevent cancer cell replication, and to support optimal immune system. So I'm never saying don't eat other things that aren't on the G-bombs. There are plenty of other good foods too. There are carrots and there are beets and there are quinoa and there's other things. I'm not saying that's all you should eat, but I just utilize that G-bomb acronym so people keep in the forefront of their mind those foods I want them to include daily in their diet. So now we can move on to something else.
If I did a little marketing for you, I hope you don't mind. I added a little virtual.
Great.
Okay.
I'll take sprouts because I am a sprouter and I've read a lot, and I got a good friend, Doug Evans, who's got a hot book on sprouting. If we're talking again about economic parity and making nutrition available to all levels of society, you can get a mason jar with some holes in the top, get a few seeds, and for pennies a week, grow living food that's hyper nourishing. It's certainly not common, but it is available, and it would be a breakthrough. We don't want elite strategies. We don't want to have to go to the grocery store and buy a $10 container of sprouted radish seeds. You can do it at home. So, as many of us know, the broccoli sprouts have maybe 50 times the sulforaphane, the probably famous anti-cancer phytonutrient that broccoli has. And broccoli has a lot more than beef. Beef has none. But if you can learn to get a couple seeds and a little water and a little cloth and a couple holes in the top of a mason jar, you are on your way to, adding a lot of nutrition on a daily basis. So I would say thumbs up for sprouts.
But I have to add, Joel, that even though I do recommend and utilize sprouts and for their beneficial effects, but encouraging people to eat a diet of mostly sprouts and to
No,
focus
not definitely not. Yeah.
on sprouts, it's not maintainable long term. People don't maintain that. So when people go on these extreme diets to that degree, they lose weight, they gain their weight back, they can't stick with it long term. And it's not even have the variety of foods you need for optimal health. So it's a great food, but not the idea that you should be on this sprout-based diet. You know what I mean?
Agree completely.
So why don't I just go in reverse order, Steve? I'm just going to give you bullet points on a handful of them because most of them are so far out of cardiology that I'm just interested in what the Joel Squared has to say about it. So for the G-bombs and the question about whole grains, there is cardiovascular literature, and including the saying that these are very positive, that we should avoid refined grains, which has been brought up on this symposium already. And the PURE trial had a publication about 2 weeks ago distinguishing the increased death rate that happens with refined grains versus whole grains. When you are doing whole grains with all that fiber, it can actually change the microbiome. That's a word that we haven't talked much about today that probably we should all be talking about all the time, according to COVID mortality and neurologic degeneration. All sorts of things are related to the microbiome, including the cardiovascular risk factor, trimethylamine N oxide. So more grains would be better. And going backwards, skipping phytochemicals, talking about the new burgers, the one that I'm concerned about is heme iron. The NIH-AARP pointed out that that was one of the correlates with mortality. Now, when they were talking about animal products having heme iron, when you put it in a burger, it makes it taste more bloody, which makes it more attractive to meat eaters, granted. But if you tell me the saturated fat, cholesterol, TMAO, all from eating animal products are bad for you, and so is heme iron, I probably wouldn't try to go after that. But it may be that it's perfectly fine in the context of not all those other things that are in animal products. So I would say I probably wouldn't give that one a pass until there was enough data to say it was good. Salts, really important to understand that most of those salts are still sodium. Now, there are salt substitutes that are potassium. We have randomized trials in hypertension that potassium chloride will actually lower blood pressure. But if you take a Himalayan salt, a pink salt, it's still sodium. And so the sodium sensitive population, which tends to be hypertensive African Americans, probably should avoid it, at least be extremely observant if you're going to do that. The bariatric surgery one, there is definite cardiovascular benefit. Isn't it a shame, going back to what Dr. Fuhrman was saying earlier, isn't it a shame that you get to that point? Why can't we all get in a time machine, go back 30 years, change the diet, and not end up having to go on the knife? Garth Davis, who's one of the prominent plant-based scientist, medical practitioners, is a bariatric surgeon, always talking about the benefits of it if he's backed into a corner, and we should do everything to avoid it. But there are cardiovascular benefits. The lipids go down, the cholesterol goes down, the blood pressure goes down, so your plaque development is going to improve. However, these people tend to gain weight. Again, they break through, which was also mentioned earlier. I have to comment on ethanol, just because there were so many people thinking that the resveratrol and red wine was going to save them and they could do just about anything they wanted. There was a little data out of Michigan State saying that cholesterol crystallization, when it gets a high concentration, is actually what breaks plaques. And the two ways of stopping that from happening were to use alcohol, and the other one was to, this is Georgia Bella, that those crystals that you can put them in your search engine, Georgia Bella cholesterol crystals, they are scary looking. To have that happen inside of a plaque, it's going to puncture the lining and it's going to give an acute coronary syndrome if that's true. So statins and alcohol were the way to stop this. Now, but that's in vitro. I think in vivo, we don't have any excuse. We don't have any great population, well-done population science. And I'd love to hear if anybody else does it. But again, I have a conflict of interest there. I hate alcohol. I hate the taste of it. So therefore, I think it's not healthy. All right, last for me would be to comment on which supplement. You're going to hear a lot more from the other panelists, but I think that we have to recognize that B12, we only have three choices: eat an animal that ate the dirt, eat the dirt ourselves, or take a supplement. and I choose to take a supplement. And to remember that there one large trial. I think Joel was talking about this on his lecture the other day. That if you were a male over 60 and you take more than 55 micrograms per day and you're an ex-smoker, it increases your risk of lung cancer. So hopefully everybody's aware of that and they're not doing it. It's hard to find 55 micrograms of B12. You have to like take something and dilute it and take a sip or something. It's not easy.
I think, Dr. Williams, you pretty much ran down the list. We didn't talk about juice. I'm a big believer, as Dr. David Katz said, if not a green juice, what are you drinking? So if you're transitioning from Mountain Dew to a spinach, broccoli-based green juice, yes, you've thrown away the fiber, and none of us probably would recommend you throw away the fiber, but you've upgraded your health, and particularly, if it's, I just suggest a glass bottle because I hate BPA.
Plastic bottles.
All those xenoestrogens and air pollution.
Doesn't that look like it?
Who took over your job was Dr. Brooks at University of Michigan, who's probably about the world expert on air pollution and cardiovascular disease. Not as much xenoestrogens and cardiovascular, but environmental factors matter. But I mean, a green juice with minimal sugar added, like a green apple, may not be a bad choice if you enjoy it. And if it's an alternative to some vice you had previously that upgraded it, I don't see a downside to it. Now, no doubt, store-bought juices and a lot of these chains that are doing smoothies that are largely sugar bombs should be, clearly avoided. But I wouldn't give, a Consumer Report total downer to a good green hair growing kind of juice that you've decided to add. Adding all that in, I don't think I have one a month personally, nor do I think I have one plant-based burger a month personally. Yeah, Joel.
I can tell you a little bit of my perspective too, is because I'm caring for people who have lupus, rheumatoid arthritis, psoriasis, other types of medical conditions and autoimmune conditions, including, inflammation from cardiovascular disease. And I have a lot of people who come to me because of gross obesity and food addiction. So what I'm saying, number one, is that with these autoimmune diseases, they become more active when their levels of carotenoid and phytochemicals are so low. And they inevitably are people who have daily headaches and they're weak and fatigued and they have pale looking skin, pasty skin. And I can feed them an ideal diet here at my facility, and it will take a certain degree of months for the level of nutrients in their tissues to get high enough. But I could accelerate the rate at which I get their tissue scores and inflammatory markers down by giving them a glass or two of juice a day, because their appetite is such where they can't take in all the vegetables, and it would take too long to change the nutrient levels in their tissues. My measurements over a period of many years is it takes 9 to 12 months to bring the levels of nutrients in your tissues as high as they are in my skin and my body tissues. And we measure that with this laser skin carotenoid scanner. So what I'm saying, by adding the juicing, especially when I'm looking to a person's coming to reverse their lupus or their psoriasis, I can get their level of carotenoids and other nutrients higher in their tissues. And then I don't particularly need to juice every day, but I may have a glass of juice a few times a week. But the juices we use have 1 part carrot, beet, 1 part lettuce, celery, cucumber, and 1 part cruciferous, like bok choy, cabbage, kale. And we use that mostly as an adjunctive nutrient when people with an autoimmune disease, because I find I can get them to get better faster, get the inflammation down, get their psoriasis, get their lupus to improve faster when we incorporate the juices as part of the program. All the other parts, of course, are equally important. The other issue is that I take care of a lot of patients that weigh between 350 and 400 pounds. And some of these people failed gastric bypass. But the point I'm making here is that most of my frustration and sorrow across most of my career is taking people that you've seen, you guys know, you see people with diabetes, with heart disease, obesity, and you could help them, and you can't, because they're so food addicted and their home environment is so negative and their attitudes are so negative, and whatever it is, they're so addicted, you can't seem to get them to follow the program strictly enough to get to save their lives. And that's always been a frustration, how difficult it is to get some people to do the necessary changes they need to make. But what I'm seeing and what I've developed is the ability to take these people into my care, into a facility for 3 to 4 months, just like a drug rehab or a cocaine facility, where you're able to treat them not just nutritionally with a time of abstinence away from their food triggers, but also psychologically, to make them see the world in a more favorable, optimistic way, to improve their self-esteem, to improve their feelings of self-worth, to not look for other people's approval, to go through all the psychological impediments they have that cause them to fall off the wagon, so to speak, in the past, and resort to food as their primary source of solace and comfort. So I'm saying that part of this is being able to reach some people. And I see that the gastric bypass industry shows the failure of our medical approach to be able to impact people with the right nutritional information, but the right psychological and supportive environments to deal with people on a level that can most effectively enable long-term change. And some of my greatest satisfaction is the close relationships I've developed with people who came in here at 390 pounds that have lost 150, 200, that have gotten their health back, that wouldn't even think of eating back the way they used to be, that have got, and some of them have had actually surgery to remove the flaps of skin, but in any case, what I'm saying is some of my greatest pleasure are the relationships of people who've been able to change their lifestyle permanently and stay with this way of eating long term. But it took a lot of effort from a whole team of supportive staff and time to help people make that change so that they can successfully stay with a healthy diet. Some people so what I'm saying is the gastric bypass industry shows somewhat of a failure of the development of their healthcare system, where we're not able to support people adequately to get rid of their food addiction and to train them how enjoyable and how better their life could be if they chose to eat healthfully and maintain a favorable weight for the rest of their life. Thank you.
Steve, I'll just jump in on the question of supplements. I mean, because I have a very supplement-driven practice, but there are clearly times it's completely inappropriate. I have many patients come to me with atrial fibrillation and pathologic status of their heart anatomy, large left atrium, valve disease, and they want to take lumbrokinase from earthworms. Well, I mean, you can't be in my practice and do that because strokes are real and people die, and we have effective drugs that often are insurance covered and have too much evidence-based. But you get into like cholesterol control. I mean, the ACC will comment on complementary approaches to lipid management beyond diet, exercise, weight control, stress management. But you got to hit the same targets. If I'm going to use red yeast rice, I got to still hit an LDL under 70 in somebody with advanced heart disease. You can't sacrifice the data. You can just take a different path. So it actually is pretty rigorous practice to try and do that. And then just for the general vegan, I mean, we've mentioned B12. There are a few brands out, and they're not mine, that are like multivitamins for vegans. It's pretty cool. Little B12, little D, little omega-3. I mean, the industry's responded to basically some science that I think Joel Fuhrman's talked about more than anybody about iodine and selenium, kind of like micronutrients that might be a lower level problem than B12, but there's solutions that are potentially out there. They're not particularly expensive, but we got to be cost sensitive too, because people can end up on hundreds and hundreds of dollars of supplements a month, and you can get a statin or an ACE inhibitor or an ARB, which are name brand, not name brand, but commonly used cardiac drugs for pennies a week if you have some kind of insurance program.
So are you recommending that everyone takes B12, vitamin D, omega-3, iodine, and selenium?
That's never been studied. We do have data that those are common deficiencies. In my practice, they're common in the general population, let alone the vegan population. But yes, if you're not eating seaweed or nori and you're not using Morton salt, you may be low in iodine. These can be measured, but it's not going to be a common practice that measures them. We've talked about omega-3. Vitamin D, we know, and probably 2020 was the year there was more discussion about vitamin D in terms of COVID than there's been about vitamin D in a lot of other conditions. Do we save lives by bringing vitamin D levels of 9 up to 34? I'm not sure we really know that for sure. It's certainly inexpensive and possible through food like mushrooms, but more realistically through pennies a day of a vitamin D, supplement of some kind.
The other issue is that there's some evidence that the zinc status on a plant-based diet is lower exposure, but as people get older, their ability to absorb zinc goes down. And there are evidence to suggest that people taking zinc have lower risk of pneumonia and other infections, especially as they age. And as heart disease and cancer become protected against the risk of developing infectious related death as you age and your immune system decreases. So I think adding zinc to the mix is conservative and is appropriate, especially as we get older. And the other thing I think I wanted to add is to talk about, two things. Number one is that most conventional multivitamins contain folic acid, and I'm a strong advocate against the consumption of folic acid. We should be getting, folate is a different chemical than folic acid. Folic acid is synthetic, petroleum derived, and there's a lot of evidence to suggest that increased risk of prostate and breast cancer. And our diet should be rich in folate from greens and beans anyway. So I'm very cautious in trying to tell people not to take folic acid, vitamin A, beta carotene, and isolated vitamin E, and that conventional multivitamins contain. And the last thing is this idea about salt. Obviously, Dr. Williams said that salt is salt, whether it comes from the back of the moon, the Rock of Gibraltar, or the Himalayan mountains. It's still sodium, and in high amounts, it has the same effects. And this nonsensical idea that there's healthy salt is just a ridiculous, alternative medicine, you could say, scam trying to sell people something. But in any case, what I'm saying right now is that salt causes pro-inflammatory over years of excessive use, causes microvascular hemorrhaging, weakens the endothelial lining of blood vessels, and increases risk of hemorrhagic stroke. And in lots of Asian countries with people with very low cholesterol, who don't eat a lot of meat and bacon and cheese, who have very low rates of heart attack, have very high rates of hemorrhagic stroke. And so what I'm saying right now is you have an increased risk of hemorrhagic stroke with a lower cholesterol, because atherosclerosis may protect some of the fragile vessels in the brain from breaking, because a hemorrhage is a break, not a clot. And what I'm saying is that we have to be very cautious with plant-based eaters, because the risk of hemorrhagic stroke is high and the risk of embolic stroke is low. And the chronic excessive use of sodium, especially from these exotic salts, could still take this plant-based eater and just change their cause of death from one type of stroke or cardiovascular death to another type. And avoiding salt is not just for people who are salt sensitive, not just for people with high blood pressure. Salt has also detrimental effect on gradually weakening the endothelium and lining of the blood vessels, predisposing you to the risk of hemorrhagic stroke. So I'm very concerned about those avenues of people trying to sell people sodium for disease prevention, to cause to like a drug, and of course, when you acclimated to a high salt diet, when you cut the salt out, you temporarily could get fatigue and hyponatremia because your body's used to putting a lot of salt. The change sometimes has to be gradual. Just like when you go from a low salt diet to a high salt diet, you're not excreting salt. But us individuals who are used to very low salt intake just from natural foods like myself, we don't sweat out sodium, and we're not losing extra minerals when we're exercising. We're not urinating out a lot of minerals and potassium, magnesium with the extra sodium we have to eliminate from all the extra salt and water we have to drink from the high salt diet. So we're much more stable without cramping, without spasm, or we don't have to worry about fluid, when we're exercising or we're playing a hard tennis match or a hard basketball game or sprinting in the heat. We're much more stable because we're not used to excreting a load of minerals in our sweat and our urine. So I'm a strong advocate of a low salt diet. Not that there aren't individuals with problems that require some extra bit of sodium, but that's relatively rare. The vast majority of individuals will do better and live longer, restricting their sodium significantly.
Just a clarification, when you all speak about heart disease and the problems and the causes, are heart disease and stroke the same, meaning is everything that when you talk about when Dr. Esselstyn or someone says a whole food plant-based diet will prevent heart attacks, is it also prevent strokes, or is it not the same?
Well, I was just talking about that, and I just want to make it clear there are two different types of strokes. There's a ischemic or embolic stroke, which is caused by a clot, which has the same risk factors as heart disease. So the answer is yes, heart disease reduction will reduce those strokes. But there's another type of strokes that's much higher in Asian countries and high salt populations, and much lower. It's 1/10 of the strokes in this country, and those are called hemorrhagic strokes. It's the breaking of a fragile blood vessel into the brain, which causes a massive bleed, which can be devastating or cause death, which is not caused by meat and cheeseburgers and bacon. And people with very low cholesterols and low animal product diets are still at risk of hemorrhagic stroke if they have a high salt diet. And that's my point, and that's my admonition. And you guys could add to that if you want.
So let me weigh in, just because there's been a lot of fervor over neurologic events in plant-based nutrition lately. And we really have to try to bifurcate this into two issues. So there was an article published just a few days ago, I guess April 8th, so it's a month ago, saying that vegan diets were associated with greater risk of ischemic stroke, 54% increase, didn't reach statistical significance. That's typical because the amount of it is relatively small, and all of these studies are not 30-year outcome studies like Nurses Health or something. Yet it was very clear with statistical significance that the carotid artery intermedial thickness, which would lead to stroke, was actually less. So there's some real confounding or contradictory stuff out there. And the bottom of this is in Journal of Nutrition. Their bottom line, I think I agree with 100%. More high quality research on this topic is needed. Similarly, a few days later, there was a publication from for 2016. So that's years, and physicians started a little bit later, but still they're out there. And what they were able to show is that this whole idea of hemorrhagic stroke observed with plant-based diet was actually due to the unhealthy plant-based diet. Now, that was published in the Journal of American College of Cardiology a couple of years ago as well. That is, I know, Stephen, that some of your supporters here are plant-based for non-health reasons and participating in this conference to get more information, but they've been an animal rights person or social vegan or environmental vegan, and those are all wonderful things. But sometimes the vegetarian diet that they're eating is full of fried food and refined grains, sugar sweetened beverages, and the like. And it turns out that the Jack article from a couple of years ago pointed out very clearly that those were more dangerous. They had more cardiac events than even an animal-laden diet, which is hard to imagine that plants could be worse. But if you treat them badly, plants can be worse than actually eating animals. But this Harvard study that was published in Neurology a few days ago was very clear that there is a lower risk of total stroke by people who adhere to a healthful plant-based diet. Once you start talking about an unhealthful plant-based diet, which is actually fairly common, then your hazard ratio for stroke goes up by about 5%. That didn't reach statistical significance. But you end up with, if you take vegetarians as a whole, the hazard ratio was 1.00. But that's because you're mixing two completely different things. People who are doing a healthy diet and people who are not.
And what about seaweed? Since seaweed has salt, but many people have mentioned that we should include it. It has iodine. What are your thoughts on sea vegetables or seaweed? Nori, wakame, kelp, dulse.
There's things out there that are just never going to be commercial successes. Seaweed, natto. I mean, we can pick some other, almost superfood status, but when you get to public palate, public access, we got a long way to go. I'd rather for somebody just eat an apple, grab some edamame. Grab some celery. We got a long way to go to get people to eat 5 or more servings of fruit and vegetables a day. But, when you're talking to an elite crowd watching this conference, trying to refine and modify their diet, the greatest diversity, there's the word microbiome coming up again, 20 or more different types of fruit and vegetables a day in your diet, which is really a difficult goal. But nonetheless, adding some sea vegetables would be a great source of nutrients that we don't normally achieve, and a little bit of iodine in the process. So, but again, I don't think I eat sea vegetables once a month, with the exception I have a nice salt-free organic sort of vegetable shake that is kelp based. So I guess I get a little bit there actually.